Um, you brought up the vertigo and dizziness specifically now, and sort of the BPPV, and what one is and kind of another versus the dizziness, and it kind of maybe want to ask you to maybe expand on that a little bit because over the years, and again, I'm taking my 13 years into this journey personality here and saying I've heard so many different definitions of it, and I've also heard interpretations of saying people practitioners saying it's extremely important for you to describe dizziness or vertigo. Like I need to know specifically what you're talking about because it might affect my treatment. But then there's others who say you don't need to have a spinning room to be considered vertigo. And some say no, that's absolutely not true. Like for me, what helped finally 10 years in was I personally found the definition of vertigo to be spinning helpful in maybe eliminating some things it wasn't. And by that, I'll talk about it later in conditions, but I had a long list of potentials, right? WebMD was like this long of all these things it could be. But so I was working my way down through like the phone book of what causes dizziness. But maybe in your words, what does vertigo or dizziness mean to you? Do you need definitions? Are there specific definitions? Just maybe back to the basics on this for us.
Sure. Dizziness is a very broad, overarching term that encompasses a ton of things. Um, and it can come from the ear system, it can come from the brain, it can come from cardiac or pulmonary conditions. And so we don't often like the term dizziness because it's not specific enough. The definitions that I kind of use and will kind of cue patients towards so that they can start to differentiate their own symptoms if they're having trouble doing so is vertigo is a false illusion of movement, and it doesn't have to be spinning, but we kind of break vertigo into two different categories. Spinning vertigo, which is what most people are referring to when they say vertigo, right? And non-spinning vertigo, which is sort of what you were experiencing, this sensation of being on a boat and rocking or swaying, is still an illusion of you moving or your environment moving that probably wasn't actually happening very much. So both of those things can technically be considered vertigo. But most frequently when people are referring to vertigo in a discussion, they're referring to the spinning type.
Right.
The other thing with vertigo that I find frustrating personally is that vertigo gets thrown around as a diagnosis. Oh, I went to the emergency room. I wasn't feeling well. I was dizzy. They told me I had vertigo. And I'm like, okay, well, what did they do? The term vertigo is not a diagnosis. It's a symptom. And so there's more work that needs to be done to make sure we're getting to the root cause of what's causing the vertigo in order to more effectively treat you. So that's just a quick aside. Other types of dizziness that we kind of use are unsteadiness. Do I feel off balance when I'm moving or even when I'm just sitting? Lightheadedness, which is that sensation of I'm on the verge of maybe I'm passing out. I stood up too quickly. The room kind of gets dark for a second and then comes back. Just that sensation like I'm not getting enough blood flow to my head. So those are the main ones that I try to break things down into those categories for people. Some people will also describe like a brain fog or their head feeling heavy or swimmy headedness, or they'll describe feeling drunk. And so there's a bunch of different terms. I try to stick to the vertigo, the lightheadedness, and the imbalance in terms of the three main things that I'm looking for.